Hello, I'm Lisa Welsh, and I was the communications manager for WAS 2021. And today I'm very excited to be speaking with Talli Rosenbaum. She is an incredible lady who really lit up my eyes with her presentation in the ISSM sexual medicine workshop. Welcome, Talli. It's great to meet you.
Thanks. Thanks for having me here.
If anybody who's watching doesn't currently know of you and your work, please could you just introduce yourself and let us know a little more about you?
So today, what I spend most of my time doing is I'm in the clinic and I'm treating individuals and couples, doing individual and couple psychotherapy and sex therapy. But I should
Fantastic.
say that my interest in sexual medicine, and this is not something that I brought up during the presentation, but my interest in medicine, in sexual medicine, began many, many years ago when I was in my first career as a pelvic floor physical therapist. So
Ah.
I have a combination of being on kind of both sides of the biopsychosocial multidisciplinary staff.
Wow. Okay. And that must bring your patients so much, so much value that you have all of that whole range of knowledge. That's amazing. Would you be so kind as to share a little bit about your actual presentation and what you spoke about?
Sure. So I was asked to speak about sex therapy, particularly for female sexual issues, female sexual dysfunction. And what I did in the presentation was I kind of divided it into half. And the way that I divided it, since most of the people who were part of this workshop were physicians and health professionals who wanted to learn more about sexual medicine. And so I would say that many of the people who attended this workshop were not necessarily mental health professionals who are doing sex therapy, certainly on a regular basis. And so, as such, what I did was, and having had knowledge of what sexual counseling, the type of sexual counseling that can be provided by a medical professional, I divided the talk into, hey, this is what any of you listening can learn to do in your practice, whether you're a general physician or a urologist or a gynecologist or a physical therapist, or a nurse, or you have any kind of counseling position vis-a-vis your practice. And until this point, this is what the model is of PLICIT, which is permission, limited information, and specific suggestions. And this is where sex therapy begins, which is intensive psychotherapy. And so I kind of talked about what is the intensive, first of all, what can you do? What is counseling about? How do you learn how to do it? And then I talked about what we do as psychotherapists individually, but also as couples therapists, and why that's important, and how to know when to identify when you're kind of out of your, I guess, pay grade, and when you should be referring, and also a little bit about how to refer.
Wow. So you did actually cram a lot of knowledge into your presentation. It was very thorough. Thank you so
Thanks.
much. And you did explain who you feel would benefit most from this, like anybody really in the medical fields that you mentioned, the gynecologists, etc. So thank you so much. It was a pleasure
You're really
to have you
welcome.
there. And the sexual medicine workshop was really, truly a great collection of minds. And something that I particularly enjoyed were the conversations that took place afterwards when everybody touched base.
Yeah, I think it was interesting because, it's a diverse conference with people who come from many different parts of the world. And of course, when we're talking about using a biopsychosocial model, we really need to be able to acknowledge culture, faith, identity. And this is a very strong part of the practice. And in fact, it kind of intersects with sexual rights, sexual autonomy. We talked about situations of marital hierarchy. And one of the things that I talked about was, and I saw this a lot when I was a physical therapist back in the day, you know, and there are several studies that have looked at specifically women who don't enjoy sex, or women who even have pain with sex, who continue to engage in sexual relations despite not enjoying it and despite the pain, for factors such as mate guarding, or the understanding that this is something that's an obligation for your marriage, as it is expected in many traditional cultures, and kind of understanding that a lot of times when a woman comes with sexual dysfunction, one of the questions that practitioners will ask is, well, you know, have you had trauma, or have you been abused in any way? And they may say, well, no, that's never happened. But when you go deeper, what you understand is, when you're seeing a woman who has had, for example, sexual pain over the course of many years, and she has continued to engage in undesired intercourse with pain, even if it's not that frequent, but she's felt like she's had to do it because there's been no other choice, that in and of itself is a source of trauma. So kind of looking beyond, also teaching doctors and teaching physiotherapists to pay attention to signs of dissociation, which can very often be confused with acquiescence or consent. Because if you're examining a woman and she's completely tuned out because she is dissociative, and you're not a mental health professional, you may not necessarily know how to recognize that. So having been a physical therapist and having confronted women who not only had dissociative responses, but may have had extreme anxiety and flashbacks, and given that many doctors and health professionals are not trained in recognizing the signs of trauma, or knowing how to deal with them, it was very important for me to not only learn how to do all that, and of course, in doing so, I gave up on treating medically. I haven't done that in many years, but also to train and teach. So I have courses for physiotherapists in trauma-sensitive physical therapy care that I teach in order to provide tools for practitioners who are really confronting in real time, in vivo, the patient's anxiety, which actually mirrors what they describe happens with their partners in bed.
Wow. Yeah, you saw the missing piece of the puzzle, and you are doing something actually to put it all together. Well, thank you. Thank you for explaining what you covered today, and thank you for the work you're doing in the world. It is so powerful. I just really want to remind everybody that is registered for the Congress and for the ISSM Sexual Medicine Workshop that they have until the end of the year to go and enjoy this content. And it is so valuable. So do it. Go and watch it. And if you're watching and you wish you had been part of the Congress, it is not too late. You can still sign up. I'll make sure that the link is below. You can get access to the whole WAS 2021 Congress for $50 now. It is like a crazy price.
Wow, that's great.
Yes, they really are leaving no one behind. They're standing by that. But thank you, Talli. I really appreciate your time today.
You're very welcome.
Thank you.
You're welcome.